Wisconsinites are dying earlier. That's according to a new study from the Wisconsin Policy Forum. It takes a look at mortality rates over the last 20 years, and what it shows is concerning. Our Braden Ross dug through the data and joins us now with the details. Braden?
Yeah, the good news, mortality rates for Wisconsinites over the age of 65 are trending down. But the bad news, they're going up for young adults. And there are a couple of big reasons why. A new study with an alarming conclusion. Wisconsinites are dying earlier.
We're just hoping it can get out there and put this issue kind of back front and center in front of people who have some ability to make potentially make some changes to address it.
The study compares mortality rates from 2001 to 2021. It found that in those 20 years, mortality rates for Wisconsinites in their 20s, 30s, and 40s went up, a trend researchers attribute largely to COVID-19 and the opioid epidemic.
I think there's reason to believe that the effect that COVID had on mortality is going to be something that's largely a one-time sort of phenomenon. When we look at overdose mortality, unfortunately, there's no indication right now that that's going to be a one-time blip.
In 2021, overdose deaths in the U.S. hit an all-time high, and they don't seem to be slowing down.
To really kind of understand the magnitude of this overdose crisis, that it has literally become so large that it's having a significant impact on total mortality among young adults.
The study also found a significant racial disparity in the state. While death rates in most categories have fallen for white Wisconsinites, that's not the case for black adults. In 2021, black adults in Wisconsin died from homicide at nearly 30 times the rate of their white counterparts. Rates of overdose death are also higher for black Wisconsinites.
The overdose death rate is somewhat higher among black Americans, but the disparity is much, much larger here in Wisconsin.
But it's not all bad news. Numbers show mortality rates for adults above the age of 65 have dropped dramatically.
Whether it's just lifestyle changes or advances in technology and medical treatment, the declines in those deaths have been really remarkable over the last couple of decades.
And when it comes to turning around some of those trends leading to higher mortality rates in young people, researchers say they hope some of the state's nearly $7 billion surplus can go towards trying to fight the opioid epidemic here in Wisconsin.